Good afternoon, everybody, and welcome to iGenis Healthcare Nutrition's webinar today. Today's focus is on nutrition interventions for managing fibromyalgia, and I am Dr. Nina Bailey. So if we look at fibromyalgia, we can break it down and get an understanding of what the condition is about. So the word fibro, for example, refers to fibrous tissues. We have my indicating the muscles and algia meaning pain. So it's a prevalent chronic pain syndrome that is characterized by widespread pain with other unspecific symptoms, including fatigue, sleep disturbances, cognitive dysfunction, and quite often there's depression involved as well. Currently, there are no diagnostic biochemical markers, and so the diagnosis itself is purely sort of determined by the symptoms themselves. So we look at things like the determination of the widespread pain index. So we look specifically at particular pressure points and the symptom severity score, which is an indication of the severity of symptoms over the last week. And we look at things like fatigue, sleep, and cognitive symptoms. And then we combine this with other unrelated symptoms such as, gut issues, nausea, that kind of thing. All of these bring about a score between 0 and 12, and then the symptom severity scale score is combined with the widespread index score to give an indication of the severity of symptoms. These symptoms have to have been present at a similar level for about 3 months, and the patient does not have a disorder that would otherwise explain the pain. And this is how we end up with a sort of fibromyalgia diagnosis. So it's currently estimated that fibromyalgia affects about 2 to 5% of the current population, and about 85% of those who are diagnosed appear to be females. The typical age is between about 25 and 55, although there are cases of juvenile fibromyalgia. And the exact cause of fibromyalgia are not really fully understood, but there is evidence that suggests that both genetic and environmental factors are involved. So, for example, if you have a first-degree relative with fibromyalgia symptoms, fibromyalgia syndrome, then you have a much greater risk of developing fibromyalgia yourself. And then on top of this, there are specific genes that can exacerbate symptoms. So, for example, if we look at the COMET gene, this is the enzyme that breaks down neurotransmitters such as dopamine and adrenaline and so on. Individuals with a specific type of polymorphism, if they have fibromyalgia, then they are likely to experience more pain on days when there is pain present than individuals who have the wild type gene. So there are specific genes that can predispose individuals to the development of fibromyalgia, and then there are genes that can sort of intensify the symptoms. So we do know that there is a sort of genetic aspect of the condition. And then on top of that, there are specific stresses that are known to predispose as well. So things like mechanical, physical trauma, injury, and we can have a look at those here. So other triggers are things like, if you already have a peripheral pain syndrome, specific infections, Lyme disease, for example. Individuals with Lyme disease often also have fibromyalgia. Physical traumas, so quite often people find that, if they're in a car accident or something like that, they will then go on to develop fibromyalgia symptoms. And then quite interestingly, if we look at factors such as psychological stress and certain sort of events such as war, both involving sort of HPA axis function and the role of cortisol. This is quite interesting because both of these are known to trigger fibromyalgia. So We know that obviously the HPA axis is involved in sort of regulating our stress response, and we know that chronic exposure to stressful experiences can predispose us to certain conditions, fibromyalgia being one of those. We also know that fibromyalgia individuals tend to have a blunted HPA axis activity with reduced cortisol. And if we look at conditions such as PTSD, so post-traumatic stress disorder, where individuals have been exposed to high levels of stress over long periods of time, so things like physical abuse, mental abuse, and the impact that that has on their sort of cortisol, and that can then go on to predispose them to certain conditions, including fibromyalgia. We also know that alongside sort of HPA axis function, we have chronic inflammation, which is indicated by a rise in pro-inflammatory cytokines, and together, alongside oxidative stress and mitochondrial dysfunction, we can then see this sort of manifestation of symptoms that include things like pain, fatigue, and memory impairment and depression, which largely categorize at least some of the patients who suffer from fibromyalgia syndrome and also chronic fatigue syndrome as well. So there is this kind of big link between HPA axis function, cortisol, and fibromyalgia. So I've mentioned chronic fatigue syndrome, which often overlaps with fibromyalgia, but there's also a host of other overlapping conditions, including chronic headaches, sleep problems, major depression, anxiety. Fibromyalgia individuals tend to suffer from things like restless leg syndrome. There's also a big link between IBS and fibromyalgia syndrome, which I'll talk about in a little bit more detail a little bit later. But kind of focusing on the kind of pain aspect, people with fibromyalgia have a heightened pain response to what would normally be considered a normal pain sort of stimuli. They also have pain responses to what we would consider to be non-painful stimuli. So there's this kind of sort of expression of the sort of pain response. And these responses suggest that these individuals have issues with pain or sensory processing. And if we just have a quick look at this slide here, so I'm not an expert in this field, so I'm not going to go into a huge amount of detail here. But what we do know is that there are high levels of substances that play a role in facilitating the transmission of pain. These substances include things like substance P and glutamate, also nerve growth factor and brain-derived nerve growth factor. These are all involved in facilitating the transmission of pain, and they tend to be higher in individuals with fibromyalgia, whereas on the other side, if we look at those substances that are involved in inhibition of pain processing, these are decreased. So things like noradrenaline and serotonin. So again, focusing on sort of pain and pain stimuli, if we look at things like the NMDA receptor, so this is involved in the process of sensory information, particularly relating to pain. Usually when pain turns from acute to chronic, we see this opening of the NMDA pain receptor. Individuals with fibromyalgia have been shown to have an increased expression of these receptors actually within the skin, so along the skin, which kind of then helps to sort of clarify why they're so sensitive to sort of like normal touch. People with fibromyalgia tend to have an overly active NMDA pain receptors as well. So then if we look at there's a small study here that I've included really kind of as an example. So we know that if you consume things like monosodium glutamate, aspartame, these are active NMDA agonists, so they will stimulate the NMDA receptor. If we withdraw these from the diet, as well as other excitotoxins, within this study, they showed that there was a 30% improvement in fibromyalgia symptoms in around 84% of those completed the diet. So restricted diets, taking away these sort of stimuli, can lead to improvements, but it kind of really emphasizes the role of NMDA. So just sort of a little bit of clarity here. For those of you who are kind of unaware of the sort of tryptophan, sort of quinolinic acid sort of pathway, we have tryptophan at the top here. Tryptophan would normally be shuttled down to produce 5-HTP, which would then convert through to serotonin, which would be the precursor to melatonin, that is involved in sort of regulating sleep and healthy mood. If the tryptophan pathway is sort of scuttled down through to kynurenine and to quinolinic acid, we see activation of the NMDA receptor, and this is where glutamate plays a role as well. Factors that can increase the tryptophan to kynurenine pathway are things like high levels of cortisol. So we see this in things like depression. But focusing on fibromyalgia, where we know that cortisol is actually low, there is a role for pro-inflammatory cytokines. So pro-inflammatory cytokines such as interleukin-6, interleukin-1. We've also got IFN and TN, tumor necrosis factor, upregulate various enzymes. So we've got IDO and KMO, which shuttle kynurenine down to produce quinolinic acid, which activates NMDA, which then causes neuronal damage. And if that neuronal damage is severe enough, we actually start to see kind of cell death. So death of neurons, which can then cause, over a period of time, sort of atrophy. And actually, this is exactly what we see in individuals with fibromyalgia. So using MRI scans, we have evidence to suggest that abnormal glutamate neurotransmission pathways leads to disrupted neurogenesis within various locations within the brain, particularly in the hippocampus. And this hippocampal atrophy is thought to, because it plays a role in memory and cognitive complaints, because it plays a role in memory and cognitive function, atrophy in this particular area of the brain is associated with fibromyalgia symptoms. And this atrophy in turn worsens or exacerbates the whole kind of symptoms that are associated. Quite often fibromyalgia patients who kind of have issues with cognitive function will talk about things like fibrofog, this sort of foggy kind of not being able to sort of think properly, not being able to function properly. And again, this atrophy and dysfunction is thought to feed forward, causing more pain, more discomfort, and more anxiety. So we kind of get this sort of vicious cycle going on. So actually, the role of pro-inflammatory cytokines is really important when we're talking about the symptoms that are related to fibromyalgia. I've spoken very slightly about the role of cortisol. We know that fibromyalgia patients have very low levels of cortisol, and when cortisol crashes, what we see is an increase in particular pro-inflammatory cytokines, so things like interleukin-6, TNF-alpha, which are sort of the pro-inflammatory cytokines that are involved in this sort of shuttling tryptophan away from serotonin. We know that low levels of cortisol act to activate microglial cells through this pro-inflammatory cascade, leading to neuroinflammation, which again that we can relate back to our hippocampal degeneration and atrophy. When cortisol crashes, we also notice that individuals tend to have an increased susceptibility to infection. So we kind of see this move from a Th1 immune response to a Th2 immune response. So individuals with fibromyalgia tend to have an increased susceptibility to infections. And I put Candida in there just as an example. There are other kind of infections as well, but Candida is quite an important one, and I'm going to mention it a little bit later on in the webinar. So our low cortisol also is known to sort of promote autoimmune disease as well. So, okay, so in addition to sort of cortisol and pro-inflammatory cytokines, we also noticed that individuals with fibromyalgia have a number of other abnormalities. So we know that there are lower levels of serotonin and melatonin, issues with cortisol, obviously. Quite often we see thyroid issues. Growth hormones are involved. We have higher levels of substance P and glutamate, and again, talking about cytokines as well. So cytokines are playing this sort of quite active role in sort of immune system response, regulation, and obviously in regulating inflammatory processes. So I mentioned autoimmune disease, and whilst fibromyalgia isn't classified as an autoimmune disease per se, it shares a lot of traits with other autoimmune-like diseases in which the body can attack itself, often resulting in the further chronic overproduction of inflammatory cytokines. Classic features found in fibromyalgia are things like elevated numbers of B cells, mentioned cytokines, but we also see a decrease in the number of T regulatory cells, and these are the cells that are involved in suppressing the immune system response, and they tend to be reduced in a number of stress-related diseases and conditions. Cytokines themselves have an effect on the HPA axis. They're involved in the sympathetic nervous system. Studies of cytokine levels in patients with fibromyalgia suggest that levels, again, and I've mentioned this, interleukin-6, interleukin-1, and so on, are elevated. Whereas we see levels of anti-inflammatory cytokines such as interleukin-4 and interleukin-10, they're either unchanged or quite often they're reduced. So talking about TREGs, again, responsible for turning off inflammation, turning it on. They help to prevent the immune system from becoming overactive, which if they're suppressed, obviously, this can then lead to autoimmune dysfunction. I'm not going to go into too much detail about TREGs today, but if anybody's interested in knowing a little bit more about TREGs and sort of nutrition interventions to focus on sort of getting our TREG cells up, then you can follow the link at the bottom there. I wrote quite a nice little article a few weeks back on nutrition interventions for ADHD with a focus on TREGs. So I thought I'd just drop that one in. Okay, so looking back at our cytokines, and if we look at the function of specific cytokines, we can start to sort of see we can build a picture, of how they then play a role in the symptoms that are involved in fibromyalgia. So, for example, interleukin-1 is involved in things like fatigue, fever, poor sleep. It induces substance P. We have interleukin-6, again involved in stress response, fatigue, depression, and again, substance P stimulates its release. And again, interleukin-8, again, substance P stimulates its production. So if we've got high levels of substance P, then we're going to be sort of inducing the production of these pro-inflammatory cytokines. In contrast, interleukins such as interleukin-4 and interleukin-10 tend to sort of be pain blocking. They seem to be calming cytokines. And if we're low in these, then again, we're going to kind of exacerbate our symptoms. Okay, so if we move on, talking about sort of our autoimmune disorders and the association with fibromyalgia syndrome, quite often we see an overlap between the two. So as I said earlier, fibromyalgia is often linked to things like Lyme's disease, but it's also associated with lupus. rheumatoid arthritis, and we see very similar sort of cytokine patterns between the two. And what's not clear currently is that the cytokine patterns that we quite often see in fibromyalgia patients, we're not quite sure whether those are actually related to fibromyalgia itself, or if they are necessarily sort of associated with the other kind of crossover conditions that are associated with fibromyalgia. So rheumatoid arthritis, for example, quite often correlates with fibromyalgia. Is the cytokine pattern related to the rheumatoid arthritis or the fibromyalgia? Not quite clear yet. What we do know is that if you have higher levels of pro-inflammatory cytokines, we deplete glutathione. So glutathione is our antioxidant sort of defense. Low glutathione itself can then activate various transcription factors, such as nuclear factor kappa B. If we then sort of upregulate our nuclear factor kappa B, we're going to produce more pro-inflammatory cytokines. We're going to get lower glutathione depletion, or we're going to get more glutathione depletion, sorry. And so the whole kind of thing just kind of carries on. And we also know that elevated levels of cytokines activate our microglia. So these are our kind of brain cells that then can produce more cytokines, inducing reactive oxygen species and so on. This then leads to sort of mitochondrial metabolic dysfunction, which then further contributes to fatigue. So we get low levels of ATP, we get high levels of inflammation, high levels of oxidative stress, and it's thought that these are responsible for the sort of like landmark symptoms that are related to not only fibromyalgia, but also chronic fatigue syndrome. So it's these kind of three together. So we've got low ATP, high inflammation, high oxidative stress, we've got low glutathione. So, you know, we need to be sort of focusing on sort of breaking this chain somewhere and focusing on an intervention that sort of hits in and sort of stabilizes. So if we look at mitochondrial function, so I talked about ATP being low, we also note that individuals with fibromyalgia and quite often chronic fatigue as well have low levels of coenzyme Q10. So this is our enzyme that is involved in the electron transport chain. It's involved in generating ATP. If we have low levels of coenzyme Q10, not only do we have a blockage in our energy conversion processes, but actually we can decrease, or we see decreases in the number of our healthy mitochondria. So mitochondria are little powerhouses required to produce ATP. So we need to have nice, healthy, plump mitochondria. We need to have nice, large numbers of mitochondria. But actually, low CoQ10 can really kind of hit this slightly. CoQ10 not only reduces gene expression that is related to the biogenesis of mitochondria, but actually CoQ10 is required for mitochondrial DNA generation. So if you don't have enough CoQ10, you're going to have lower levels of mitochondria. So you're going to have less capacity as well. The other thing that low CoQ10 does is that it causes a collapse of the mitochondrial membrane potential. And this induces mitophagy. So mitophagy is a process that is involved in sort of clearing up little bits of debris, little bits of damage, without actually damaging the mitochondria itself. So it's a kind of a self-preserving process. However, if you have excessive mitophagy, this induces an ATP-dependent apoptosis cell death process, which then exacerbates ATP depletion, and then this leads to the further production of pro-inflammatory cytokines. So low CoQ10, in summary, can promote either loss of mitochondria through promoting apoptosis, or it can decrease the numbers of our mitochondria by kind of impeding their natural sort of biogenesis. And just a little diagram here, really to sort of emphasize this relationship between inflammation, mitochondrial dysfunction, and fatigue. So we have our stressed and damaged mitochondria. We get impaired oxidative phosphorylation. This in turn leads to impaired energy production, and vice versa. Impaired energy production leads to impaired oxidative phosphorylation. We get high levels of oxidative stress, so we get decreased antioxidants, they get used up. We get increased free radicals. We get impaired fatty acid metabolism. So everything starts to sort of kind of fall to bits slightly. So there's this big, strong relationship between mitochondrial dysfunction, inflammation, and fatigue that is related to both fibromyalgia syndrome and to chronic fatigue syndrome. Evidence for CoQ10 interventions is very promising. There has been a couple of really nice meta-analysis published over the last couple of years. Obviously, with sort of issues with sort of study design and methodology, we have to be a little bit careful how we interpret some of the studies that are coming out. But generally, the overall sort of emphasis of these studies is that increasing our CoQ10 intake through supplementation increases CoQ10 levels in the body. This then in turn leads to lower levels of pro-inflammatory cytokines, low levels of inflammatory markers such as C-reactive protein, and in turn we would expect to see induced sort of improvements in sort of energy output. Just an example of a small study that was published a few years ago, looking at the effect of CoQ10 supplementation in fibromyalgia syndrome. Relatively small in terms of subjects with fibromyalgia. But it was a double-blinded placebo-controlled trial using ubiquinol rather than ubiquinone. So just for those who may not be completely clear about the difference between ubiquinol and ubiquinone, CoQ10 exists in two different forms. Ubiquinol is the reduced antioxidant form of CoQ10. It only really kind of came onto the market about 10 years ago. Because obviously with stability issues, if it's exposed to air, it just converts straight back to ubiquinone. So ubiquinol supplementation is relatively new, but the evidence that is coming out from the studies that are being published tends to indicate that actually as a supplement, it appears to be superior to ubiquinone. Certainly for sort of seeing sort of like long-term benefits. So ubiquinol supplementation, 100 milligrams a day for 12 weeks resulted in not only increased CoQ10 levels, but actually improvements in chronic fatigue scores as well. So quite a strong sort of call there for increasing CoQ10. Another area to just focus on for a couple of slides is the relationship between homocysteine and fibromyalgia. So individuals with fibromyalgia and actually chronic fatigue as well tend to have higher levels of homocysteine. So this isn't always the case, but it is worth something it's worth something to consider if you're seeing a client with fibromyalgia. So homocysteine is a natural byproduct of the methylation cycle, generally remethylated either back to methionine, or it can be directed down into the sulfuration pathway to produce glutathione. Classic deficiencies of things like folate, B12, B6 can impede this pathway, resulting in higher levels of homocysteine. And so certainly when we're looking at cases of fibromyalgia, chronic fatigue syndrome, it's certainly worth looking at sort of nutrient deficiencies. The issue, obviously, with homocysteine is that it increases things like oxidative stress, and it also activates our glutamate receptors on our NMDA. So we little diagram here to just really kind of emphasize this. So It's an oxidative product of homocysteine and functions as an excitatory neurotransmitter activating NMDA. So it's going to exacerbate your pain if you have fibromyalgia and you have high levels of homocysteine. Classic in addition to low folate and low B12, we also see issues with things like methyl tetrahydrofolate polymorphisms. Also, there are polymorphisms in CBS as well, but they're not quite as common. But actually, so if you have fibromyalgia and you have the methyl tetrahydrofolate polymorphism, that lowers your ability to recycle homocysteine, then it's worth sort of having a look at that as well, making sure that the homocysteine recycling is well maintained. Focusing on B12, quite often, one of the sort of biggest indicators of having high levels of homocysteine is because you've got low levels of B12. So if we have a quick look at B12 in fibromyalgia and what might be leading to low B12, again earlier I mentioned the kind of relationship or the link between IBS and fibromyalgia. These two seem to go sort of hand in hand. So any kind of digestive disorders, if you've got sort of poor gut function, if you've got a little bit of leaky gut, anything like that, damage or inflammation within the GI system, then this could in turn lead to small intestinal bacterial overgrowth, dysbiosis, increase the risk of things like Candida, which are all going to impede your absorption of B12. Using acid reduction medications, again, so anything that basically blocks the secretion of intrinsic factor is going to reduce your absorption of B12. Also links with poor absorption of iron as well, which I'll just mention in a moment. So yes, so individuals with fibromyalgia, if they've got poor absorption of B12, this could then lead to higher levels of homocysteine, hypomethylation, but also this sort of overactivity of NMDA receptors and sort of increased pain. So anybody who's visited one of my webinars before, again, will have seen this slide, and I think I get it into most of my talks now because obviously the relationship between sort of healthy methylation seems to come into the kind of criteria of just sort of covering just about every kind of health condition that you can think of. So we need to have sort of healthy methylation pathways just to keep everything ticking over. So healthy neurotransmitters, we need it for making our cell membranes, we need it for fatty acid metabolism, and so on. Anything that is going to impede our ability to recycle our homocysteine is going to have a knock-on effect. So we also kind of see things down into the transsulfuration pathway and the sulfation pathway as well. So our key sort of cofactors are things like magnesium, B6, zinc, B12. Need to make sure that we get plenty of these in the diet. If not, supplementation may be wise. If we don't have healthy methylation, if we have higher levels of homocysteine, then it's going to disrupt a number of pathways. That is all going to sort of exacerbate any kind of symptom that's related to fibromyalgia. We also see that it's going to affect our sort of ability to make glutathione as well. And I've kind of mentioned the importance of glutathione earlier. This kind of key antioxidant involved in sort of regulating ROS, for example. So another area to just sort of consider very briefly is the role of stomach acid in fibromyalgia. Again, low stomach acid is quite often observed in individuals with fibromyalgia. If you don't have enough stomach acid, as you're probably all aware, we're not going to be digesting food properly, so specifically things like protein. Stomach acid is needed to promote good gastric emptying, but it's also creates an environment that is quite hostile for the sort of bad bacteria and things and sort of fungal infections that we don't want. So if you've got low stomach acid, then you're predisposing yourself to a number of kind of sort of poor health areas. So one thing that's quite interesting is that looking at some of the studies that have been published, there seems to be a relationship between protein malabsorption and fibromyalgia. So some individuals appear to have a poor ability to absorb specific amino acids. And there was one study that I came across that showed that fibromyalgia patients appear to have low levels of branched chain amino acids. And when we consider these amino acids play a really vital role in kind of muscle structure, function, production, then we can see how that kind of then relates back to sort of pain and muscle fatigue itself. Dysbiosis, leaky gut, and fibromyalgia. So pain intensity with people with fibromyalgia seems to be correlated with the degree of dysbiosis. So if we look at things like intestinal bacterial overgrowth, which is quite often seen in fibro, we find that the kind of the worse the overgrowth, the worse the symptoms of pain. So sort of focusing on healthy gut function is probably going to be key in sort of managing fibromyalgia. Obviously, leaky gut is then going to lead to an exposure of immune cells to sort of luminal antigens, consequential immune modulation. We quite often find that people with fibromyalgia have various food intolerances. So again, we need to be focusing on sort of gut function and promoting healthy guts. And just a nice little diagram that I found from a paper that really kind of emphasizes the relationship between sort of bacterial overgrowth, how that influences our tryptophan metabolism, which is going to impact on sort of normal serotonin production, which is going to impact on things like muscle fatigue, sleep disturbances, bacterial overgrowth, also lipopolysaccharides stimulate through toll-like 4 receptors, which are then going to enhance things like prostaglandin production, cytokine release, and again activate our NMDA receptor pathways. Bacterial overgrowth then promotes things like the sort of impairment of mitochondrial function, which again is going to lead to things like mitophagy, which if then that gets out of hand is going to reduce our mitochondrial numbers, which is then going to sort of promote and exacerbate things like muscle fatigue, chronic pain, general energy as a whole. So we can see that, you know, if we start sort of like looking at sort of the gut itself and the health of our gut, we can really kind of focus on where we really need to start. Okay, so we've talked about inflammation and leaky gut. We know that prolonged and excessive stimulation of membrane-bound toll-like 4 receptors further exacerbates the production of pro-inflammatory cytokines, free radicals. Again, going back to the fact that our free radicals damage mitochondrial lipids and proteins, again leading to dissipation of the mitochondrial membrane potential, inhibiting electron transport chain. This is then going to carry on and sort of contribute to this sort of inflammatory pathway that is related to fatigue. So if we look at the kind of papers and the sort of evidence out there for the link between oxidative stress and fibromyalgia, again, it's that vicious circle effect, and it's not quite clear whether oxidative stress is a cause or consequence of having sort of inflammatory sort of related symptoms. They're both involved in oxidative and nitrosive stress, both are involved in the pathogenesis of pain. both involved in the induction of several cytokines. Substance P, which is co-released with glutamate, has been shown to increase the permeability of the blood-brain barrier, which would normally be there to sort of protect the brain from high levels of things like dietary glutamate as well as other things. But we know that there is this sort of imbalance of oxidants and antioxidants in fibromyalgia syndrome patients. We've seen that levels of glutathione and catalase, so antioxidant enzymes, tend to be lower. We know that pro-inflammatory levels and higher levels of inflammation are present. There's a significant correlation between serum nitric oxide levels, for example, and pain, and a significant correlation between levels of glutathione and things like morning stiffness. So if we can increase our antioxidant capacity and we can sort of dampen the inflammatory response, then we can see sort of methods that we can use to sort of reduce pain and some of the other symptoms such as morning stiffness and fatigue. So this is our little friend Candida. And again, highly associated with fibromyalgia. So Candida problems arise when the sort of benign yeast form mutates into its fungal form. This then produces toxins that create these little holes within the intestinal lining, leading to leaky gut, inflammatory immune response. We get food intolerances, and it's kind of an ongoing sort of spiral of events, really. We also know that use of things like antibiotics, oral contraceptives, anti-inflammatory steroids, non-steroidal anti-inflammatory drugs, all increase our susceptibility to Candida. So we really need to sort of get in there and have a look and see what our clients actually been using over the sort of course history, and what they're using now as well. I mean, part of the issue with anybody with fibromyalgia is obviously the sort of pain relief that they're taking is going to be exacerbating a lot of the pathways that are actually involved in the syndrome itself. Looking for a couple of slides on the impact on thyroid health, we know that fibromyalgia syndrome patients often have autoimmune thyroid disease, and the estimated sort of rates is about 30%. In addition to sort of autoimmune thyroid disease, common deficiencies of certain micronutrients, including iron, selenium, vitamin A, and zinc, are known to interact with iodine nutrition and thyroid function. Again, and I mentioned this earlier as well, we need adequate stomach acids for iron absorption. If we don't have adequate iron absorption, then this itself kind of exacerbates or reduces our ability to produce T4 and T3. Selenium is a key cofactor in the conversion of T4 to T3. So basically things like iron deficiency, B12 is involved as well. These sort of micronutrient deficiency go hand in hand with low thyroid activity. Thyroid activity then worsens due to things like iron deficiency, and so again we get this kind of vicious cycle. So we need to sort of be focusing on sort of improving gut function so that we're absorbing our nutrients, so that we are looking after all of these kind of pathways. So we're looking after our thyroid health, we're looking after our adrenal health, and if we can get all of these kind of patterns and all of these sort of systems working effectively again, we can start to see improvements down the line. Another interesting observation is the link between fibromyalgia and obesity. Epidemiological studies suggest that around 40% of patients with fibromyalgia are obese and around 30% are overweight. Again, it's one of those kind of vicious cycle things. If you have fibromyalgia, then the symptoms of fibromyalgia themselves are very likely going to lead to sort of weight gain, that sort of lack of movement, the constant pain, possibly not absorbing nutrients, but having high calorie intake. what we do know is that sort of the leptin that is produced by our white adipose tissue is overexpressed in obese patients. This has a decreasing effect on pain threshold. So the more leptin you produce, the higher, the more pain you experience. So there's this big relationship between leptin, pain response, and nociception. Obesity, interestingly, also leads, because of the pro-inflammatory cytokine link, will then have an effect on IDO activity. And then what we see in obese individuals is the chiurin and tryptophan ratio is enhanced. So going back to my earlier slide to emphasize this, pro-inflammatory cytokines produced by white adipose tissue upregulate IDO, KMO, then they're going to further exacerbate our NMDA receptors, causing further neuronal damage. We get the tryptophan steal away from 5-HTP, so we're going to exacerbate things like sort of low serotonin, which is going to be involved in things like depression, again, poor sleep. So focusing on sort of maintaining a really good healthy body weight is also very important. So the current sort of standard interventions are really things like non-steroid anti-inflammatories. Some antidepressants have been shown to be very beneficial, muscle relaxants, tranquilizers, pain medications. Usually a combination of many different sort of pharmaceuticals have been can provide some short-term relief for some individuals. However, we're all aware that these sort of interventions don't really address the cause, and quite often the side effects can potentially cause more symptoms than they help. Other pain management interventions include things like intensive physical therapy, exercise, but very difficult when we're kind of talking about fibro, but the pain that is involved in that. But there is a lot of evidence for sort of exercise therapy. CBT counseling, again, this is through the sort of cortisol relationship as well. So a lot of evidence for sort of mindfulness, sleep hygiene can all be sort of effective in managing fibromyalgia related symptoms. And obviously on top of this, sort of good dietary practices as well. So the kind of key sort of dietary interventions is, think about what we need to remove, things like highly processed refined foods that are going to sort of exacerbate our ability to absorb and get benefits from sort of micronutrients from food, additives and artificial sweeteners. So we're talking about things like aspartame, which I've mentioned about NMDA, monosodium glutamate, so check your packaging very carefully because that's in a lot of foods. And again, sugar and refined carbohydrates. So there's a lot of focus on sort of managing healthy blood sugar levels. Because there are such a diverse amount of symptoms that are associated with fibromyalgia, and everybody is very, very different, it might be worth considering some tests. There's a lot of tests out there. Some will give a certain amount of information on certain areas, and obviously others on other areas. Homocysteine is relatively cheap. It will give you an indication of sort of healthy methylation. Stool tests will give you an indication of, the sort of the structure and function of the gut. Is there dysbiosis? Is there Candida? Sig-A, have a look at that as well. Stress cortisol tests give an indication of, the cortisol levels, and so on. I don't need to sort of list them all and go into them all because you're probably all very aware of them. So it is worth considering doing some tests with your clients. The key really to sort of managing fibromyalgia is the list here. And again, everybody's going to be very different. Some individuals will be expressing certain symptoms and others will have, very severe symptoms. But the emphasis really always kind of comes back down to gut support. So if we target the gut, then we kind of indirectly start to target other areas and other body systems. We need to be looking at mitochondrial support, healthy methylation, looking after our thyroid, supporting adrenal, especially when there's low cortisol, the classic anti-inflammatory diet protocol, and get our antioxidants increased. So either directly or indirectly. So we've got our antioxidants from our food. We've also got our antioxidant enzymes. We can boost levels of those as well. So a kind of a myriad really of sort of interventions here. Focusing on addressing gut health first. Obviously, you know, anything that sort of disrupts our gut function leads to excess inflammation in the gut lining. This is going to cause changes in the normal gut flora, leading to things like dysbiosis and Candida. Quite often, if we have inflammation, we, you know, damage our enterocytes, so we get reduced levels of things like digestive enzymes. So we might need to be looking at maybe some digestive enzyme support to sort of help with absorption issues. Restoring normal gut flora with supplemental probiotics. Again, certain type of bacterial strain have sort of different functions. So, you know, looking at specific types of gut flora strain can be really helpful. So there are some that have been scientifically shown to help repair leaky gut, reduce Candida numbers. Others will ferment sugars into lactic acid. So things like Candida don't like acidic environments. They prefer to be living in an alkaline environment. So if you've got low stomach acid, for example, we've got certain strains that will help to promote Treg cells. We've got antimicrobials, including things like natural probiotics, so, you know, fermented foods and so on. And then looking after sort of gut function through things like L-glutamine. So our little cells prefer this particular amino acid. L-glutamine is also known to sort of boost our immunity, including a little bit of prebiotic bacteria food might not be a bad idea as well. And I find inulin is quite beneficial. We then sort of can have a look at some other sort of factors here. So things like coconut oil, MCTs can be quite useful. Coconut oil is very good as sort of antifungal, anti-candida. Increasing natural stomach acid, so apple cider vinegar, betaine hydrochloric supplements, ascorbic acid can be very good as well. Obviously, if you're having high dose of ascorbic acid, so that's basically vitamin C, that's going to be very good for adrenal function as well. Garlic reduces Helicobacter pylori, if I pronounce that right. Forgive me if I haven't. And the best garlic supplement that I've found is Allicin Max. I take that one myself, and I really, really think that's the strongest active garlic supplement that I've certainly been able to find. Medicinal mushrooms, things like bone broth, gelatin, collagen. Let's get everything sort of healing. Vitamin D3 and vitamin A are known to promote Sig-A production, so again, sort of good gut function. And I sort of mentioned things like digestive enzymes as well. So focusing on gut is really, really important. Obviously, you know, we need to sort of focus on avoiding our sort of typical Western style diet. So we knock out all of our processed refined foods. The sort of high fat, high sugar sort of combo is a bit lethal as well for guts. Adopting a whole food diet is really important. So this is not only going to sort of promote a healthy gut flora, it's going to help with our immunity. It's also going to help with sort of liver function too. When we are addressing sort of adrenal health, we need to be looking at foods with a low glycemic index so that we can release our natural sugar slowly, so that we can keep our blood sugar levels nice and sort of steady. Stress, looking at the impact that sort of chronic stress has on things like gut function and serotonin and that kind of thing. Taking time out, breathing techniques, physical, again, sort of talking about physical activity. Mindful meditation, you know, we can't promote that enough. If we're looking at sort of compromised nutrient absorption, obviously with leaky gut, we see malabsorption of vital vitamins and minerals. So zinc, iron, B12, get these sort of increased within the diet or through supplementation. Raw foods. Raw foods are naturally rich in their own digestive enzymes. So sort of trying to promote as much raw food intake as possible rather than sort of cooking or heating can be beneficial. Again, these will sort of boost our immune system and support sort of healthy liver function as well. So the whole kind of clean eating, and this is another slide that I use quite a lot throughout my webinars, and this is really this stems from a talk that I gave on cognitive function and the Mediterranean diet. But I think if we look at foods that are included in things like the Mediterranean style diet, they kind of really provide all the sort of raw materials that we need for sort of supporting all of our sort of organs and tissues and pathways, and keeping our energy metabolism up, looking after cell membrane integrity, methylation pathways. So all of these wonderful foods provide the building blocks that we need to sort of support all of these pathways, and also focusing on maintaining a healthy weight as well. I mean, that might even be something that is the sort of first port of call, really. If you have a fibromyalgia patient or a fibromyalgia client, and they are carrying a little bit too much weight, then sort of focusing on maybe sort of looking at ways to sort of maintain a healthy weight can be really beneficial. There is a lot of evidence that just weight loss alone can actually reduce things like pro-inflammatory cytokines, inflammatory markers, CRP, and so on. Looking at adrenal support, you're probably aware of the kind of classic sort of ways of looking after adrenals. So things like avoiding sugar and artificial sweeteners, avoiding caffeine, talked about clean diets, high protein, low carbohydrate breakfast, small meals regularly throughout the day will help to optimize blood sugar levels, and getting plenty of rest as well. So, and I've included a few examples of supplements that might be a benefit as well. Vitamin C, as I've mentioned, is one of the sort of classic sort of vitamin, simple vitamin, cheap vitamin interventions that can be used just sort of promote adrenal support. So in addition to increasing our sort of antioxidants, things like vitamin E, vitamin C, and so on, increasing glutathione is really, really important. So this is our key kind of detox enzyme. We can upregulate our glutathione-related enzymes and things like the flavonoid family. So phytonutrients are really, really good for doing this. So they're found in things like green tea, honey, fruits, vegetables, nuts, olive oil. I mean, if we go back to the slide really where we're looking at the sort of Mediterranean style diet, if we're doing that kind of thing, then you're going to get plenty of polyphenols in your diet. Vegetables such as broccoli, kale, and cabbage, these again are going to be containing antioxidants that naturally increase the production of detox enzymes in the body. Important also to consider sulfur-rich foods and cysteine-rich foods. These are all going to help promote sort of glutathione production. Talked about polyphenols. I'm just going to mention curcumin as well. Curcumin supplementation. Again, this is a slide that I've kind of borrowed from another webinar that I held a few months back. But curcumin has been shown to increase things like antioxidant status, catalase activity, glutathione. It's also been shown to reduce levels of things like salivary amylase, which is a kind of a marker of our sympathetic nervous system stress. So curcumin supplementation can actually have benefits, not only increasing antioxidants, but actually can decrease stress as well. So we've got glutathione as our sort of like little antioxidant enzyme in the middle of our little diagram here. In order to keep glutathione sort of processing, we need to have certain other antioxidants within our diet as well. So to support our antioxidant defenses, I recommend things like alpha lipoic acid, vitamin E, again, going back to benefits of vitamin C, CoQ10 is in there as well. And what we find is that, that it's almost like a sort of cog wheel effect. So if we have a good array of antioxidants, then it's going to support these antioxidant defenses and antioxidant pathways. Looking at NMDA receptor, I've spoken about this in quite detail. So this is involved in pain modulation, pain pathway, pain processing. Overactivity of NMDA is going to increase pain. Nutrients that are known to be involved in this pathway are things like magnesium, zinc, and B6. So these are vital cofactors. These are vital micronutrients to be increasing in the diet. Not only do they play a role in sort of reducing the effects of NMDA, but they're also required for the conversion of various different amino acids into their neurotransmitters. So for example, if you've got low zinc and B6, then your glutamine is going to get blocked at glutamate rather than carrying through to produce GABA. And so if you've got low zinc and B6, you're going to get higher levels of glutamate, which is going to go off and start stimulating your NMDA receptors. So increasing our B6, zinc, and magnesium is really, really important. Other nutrients also to consider are things like zinc. Again, this is involved in sort of pain processing. Selenium is great for upregulating glutathione production, is the main component of many of the antioxidant enzymes. So also supports adrenal function as well. So as a omega-3 intervention, you're probably aware of our Pharmepa Restore, Pharmepa Maintain. Pharmepa Restore is pure EPA, helps to balance out AA to EPA ratio, and therefore help to promote healthy eicosanoid production, which is going to help balance sort of pro-inflammatory cytokine pathways. EPA has been shown to reduce nuclear factor kappa B, CRP, pro-inflammatory cytokines, and so on. Individuals, certainly with chronic fatigue syndrome, have a reduced capacity to make long-chain omega-3 fatty acids. The same appears to be true of fibromyalgia, although sort of evidence-wise, and the studies tend to focus more on chronic fatigue syndrome than fibromyalgia. But I would suggest that there are numerous benefits from ensuring a good intake of omega-3. We should be looking at least 1 to 2 grams of omega-3 a day. Generally, the sort of UK population doesn't like their oily fish, so our intake is relatively low. So that's just the general population. I would suggest that fibromyalgia individuals would certainly benefit from increasing omega-3, help to maintain structural support, lower inflammatory processes, and so on. As a supplement for combining the benefits of zinc, magnesium, and B6, Neurobalance is the one to go for here. This is a fully reacted magnesium citrate, so highly bioavailable. We use zinc L-methionine, we use B6 as peroxidol 5-phosphate. So all in regards to the sort of efficacy of the ingredients, this is going to be certainly the best bet for looking after zinc, B6, and magnesium for sort of cognitive benefits as well. And then just a little note on our Longvida curcumin. This is the product that I talked about a little bit earlier, involved in increasing glutathione, lowering things like, again, curcumin has been shown to block nuclear factor kappa B, and if you block nuclear factor kappa B, then you're going to reduce all your sort of pro-inflammatory cytokines, get that all balanced out nicely. As a general kind of multivitamin mineral support, we've got a 22 key essential vitamin and mineral product here. So we've got iodine, we've got iron, we've got all the kind of micronutrients if you feel that your clients are sort of short on everything. And then for mitochondrial energy support, we've got our Vesisorb ubiquinol QH. So this is the kind of similar product that I spoke about in the study a few slides back in the juvenile fibromyalgia cases. The Vesisorb aspect of this, or the Vesisorb delivery system, means that you get nice high levels of therapeutic targeted levels of CoQ10 as ubiquinol, and they stay, or the levels stay high for longer as well. So as an intensive CoQ10 supplement, Vesisorb ubiquinol, again, is going to be the best bet. For anybody who's just kind of like looking for a general all-rounder, this is an excellent product for somebody, maybe if they're on a bit of a budget, or you just feel that they just need a few sort of micronutrient, sort of omega-3s and things like that as a bit of a helping hand. It's a combination of magnesium. So this is, well, it sort of covers the magnesium, the zinc, and the B6. We've also got B12 in there. So it's going to cover things like methylation support. 5-HTP as our sort of precursor to serotonin is in there as well. And then we've got, because it's a duo capsule, we've got a really good high dose of omega-3 in there as well. So again, we go for the high EPA-DHA ratio. So we've got EPA at 410 milligrams, DHA at 250. Again, a little bit of vitamin D3 in there as well. There's a lot of evidence to suggest that vitamin D3 deficiency is also going to exacerbate pain processing pathways. You know, a lot of literature been coming out over the last couple of years suggesting that we're all pretty much deficient in vitamin D3. So that's another one to sort of consider supplementation. So as an all-rounder, I think MindCare Lift kind of is a really good sort of quality product and exceptional value for money as well. And so this is the last of the slides for the webinar today. The link at the bottom is actually, I have to apologize for that, that's actually a link through to histamine tolerance for anybody who's interested. I think this slide has come from the last webinar that I gave on histamine intolerance, so my apologies for that. Anyway, thank you very much, everybody, for your time today. If you have any questions or any queries, or you want to know about products or anything more about anything that's been included in the webinar, feel free to get in touch. My name is Dr. Nina Bailey, and this is my colleague Sophie Tully, who is Head of Education, and she'd be delighted to answer any of your questions as well. I hope you enjoyed the webinar today. Have a look online, and I hope to see you possibly at some of our upcoming, probably New Year now, webinars. Okay, and thank you very much indeed, everybody. Take care now. Bye-bye.